The calls have been relentless. This patient needed to be flown by plane to the Bay Area for care. Did he have a crew? That patient was awaiting transfer by helicopter to Santa Barbara for treatment. Could they swing it? Everyone's tired because this has been going on for so long, said Sergio Cardenas, a longtime flight nurse who now serves as Reach Air Medical Services Program Director in Imperial County, a swath of agricultural land wedged into the southeast corner of the state against Mexico and Arizona that has become the California county hit hardest by the coronavirus pandemic. We see this as a marathon, not a sprint. For years, the company has helped the state move patients from hospital to hospital, flying people who had suffered bad heart attacks or traumatic injuries that required more care than the county's 2 hospitals could provide to places like San Diego or Palm Springs. Then COVID-19 hit. In recent weeks, the company has been transferring patients overwhelmingly battling the highly infectious disease to distances farther than before, including to places such as Silicon Valley. COVID is a different animal, Cardenas said. According to the California Emergency Medical Services Authority, at least 15 people have been moved from Imperial to hospitals in the Bay Area. UCSF, which has relatively low numbers of coronavirus patients and can offer highly specialized care, said this week it had received at least 3. Stanford has also accepted patients. The process of transporting patients isn't new to hospitals and healthcare workers, and California has a process in place for figuring out who should go where. As a state with a high risk of earthquakes and wildfires, this type of system enables us to respond to large-scale emergencies, said Adrienne Green, UCSF Medical Center's chief medical officer. But with the number of coronavirus cases across the Golden State soaring above 237,000 and hospitals in Imperial County at capacity, and with nearby hospitals in Riverside and Los Angeles also filling quickly, the system has been tested as never before. At least 500 patients have been transported out of Imperial County during the pandemic. One night, Cardenas said, his team mobilized 5 or 6 helicopters and 3 or 4 planes to move patients. Before the coronavirus hit, transfers typically took 3.5 hours. Now, with flight nurses and flight paramedics having to put on and safely remove masks, gloves, gowns and goggles in the searing desert heat, the process can take hours longer. And at times, he's had to tell hospitals they'll have to wait because, we just don't have anybody. Imperial has become the entryway for U.S. citizens living in Mexico seeking medical care. Around 7,000 people in the county have contracted the virus. More than 100 have died, with almost 1 in 4 people tested turning up positive.